Pleuritis. Pleuritis. The basics: definition, pathophysiology, and etiology. 1. Definition. Inflammation of the pleura. Inflammation of the pleura. Pleuritis, also sometimes called pleurisy, refers to the inflammation of the pleura, the thin membrane that lines the lungs and the inside of the chest cavity. 2 layers. The pleura is made up of 2 layers. Visceral pleura lines the surface of the lungs. Parietal pleura lines the inner surface of the chest wall. Pleural space. The space between these 2 layers contains a small amount of fluid that reduces friction as the lungs expand and contract. Note: inflammation of the pleura can cause significant pain and discomfort. Note: pleuritis is not a specific disease, but rather a symptom of an underlying condition. 2. Pathophysiology. The mechanisms of inflammation, irritation and inflammation. Any process that irritates or inflames the pleural surfaces can lead to pleuritis. Increased friction. Inflamed and roughened pleural layers rub against each other during breathing, causing pain and further inflammation. Pleural effusion. In some cases, inflammation can cause increased fluid production in the pleural space, pleural effusion. Note: an increase in fluid volume in the pleural space separates the pleural surfaces, which can decrease some of the pain. Cellular infiltration. Infiltration of immune cells, such as neutrophils, lymphocytes, and macrophages, into the pleural layers, contributing to inflammation. Note: the pathophysiology varies based on the underlying condition. 3. Etiology. What causes pleuritis? Infections. Viral infections, the most common cause. Respiratory viruses such as influenza or adenovirus can cause pleuritis, as well as other systemic viral infections. Bacterial infections. Bacterial pneumonia, tuberculosis, or other bacterial infections in the lung can spread to the pleura. Fungal infections. Rarely, fungal infections can cause pleuritis. Pulmonary conditions. Pulmonary embolism, PE. A blood clot in the lung can cause pleuritic pain. Pneumonia. Infection in the lung can cause inflammation of the pleura. Pneumothorax. Air in the pleural space causing lung collapse can cause inflammation and pain. Autoimmune disorders. Systemic lupus erythematosus, SLE. An autoimmune disease that can cause pleuritis. Rheumatoid arthritis, RA, another autoimmune disease that can cause pleuritis. Malignancy. Lung cancer. Malignancy involving the pleura. Metastatic cancer. Cancer that has spread from other organs, including breast cancer, lymphoma, and others. Trauma. Chest injuries can cause inflammation of the pleura. Medications. Certain medications can cause pleuritis. Other causes. Asbestosis. Exposure to asbestos can cause pleural thickening. Uremia. Patients with renal failure. Note: it is important to identify the underlying cause of the pleuritis. Clinical manifestations and diagnosis. Recognizing and investigating pleuritis. 1. Clinical manifestations. Recognizing the signs and symptoms. Pleuritic chest pain, the most common symptom. Sharp, stabbing pain. Often described as a sharp or stabbing pain that is made worse by breathing, coughing, or sneezing. Localized pain. Usually localized to the chest area, and is lateral and often unilateral. Pain changes with breathing. Pain typically intensifies with deep breaths or cough. Dyspnea. Shortness of breath, especially with deep breathing. Cough. A dry cough is usually present, though it can sometimes be productive. Shallow breathing. Patients may try to breathe more shallow to reduce the pain. Friction rub. A high-pitched scratching sound may be heard on lung auscultation. Symptoms of underlying conditions. May also present with symptoms of underlying conditions, e.g. fever, fatigue, cough. Note: the clinical presentation is variable depending on underlying condition. Note: pleuritic chest pain is a very specific type of pain that you should recognize. 2. Diagnostic workup. A step-by-step approach, history and physical examination, detailed history of symptoms, and past medical history, as well as a careful physical exam that includes lung auscultation. Chest X-ray. Initial imaging test that may show pleural effusion, pneumonia, pneumothorax, or other lung abnormalities, or mass. Note: can help exclude other conditions. Computed tomography, CORT, scan of the chest, can provide more detailed imaging to evaluate the pleura, and help to assess underlying disease processes. Note: may be done if there is high suspicion of an underlying disease process. Ultrasound can help to detect pleural effusions or empyemas. Pleural fluid analysis: if there is a pleural effusion, a thoracentesis can be performed, and fluid can be sent for analysis. Cell count, protein, glucose, LDH, cultures. Note: may help to determine the underlying cause of the effusion. Blood tests: complete blood count and inflammatory markers may help to indicate if there is a systemic infection or inflammation. Specific tests, based on clinical suspicion to diagnose underlying cause. Pulmonary embolism workup, D-dimer, CT pulmonary angiogram. Autoimmune workup, ANA, rheumatoid factor. Specific cultures and stains to identify an infection. Note: diagnosis depends on a combination of clinical and diagnostic findings. Management strategies for treating pleuritis. 1. Pain management. The primary goal: nonsteroidal anti-inflammatory drugs, NSAIDs. First-line therapy for pain management. Note: usually effective for reducing pain. Analgesics: opioids for severe pain, but they need to be used with caution. Note: the type of analgesics will depend on the severity of pain. 2. Treatment of underlying cause. Antibiotics, if the cause of the pleuritis is an infection. Anticoagulation, for pulmonary embolism. Corticosteroids or other immunosuppressants, for autoimmune conditions. Antifungals, for fungal infections. Note: specific treatment will depend on the underlying condition. 3. Management of complications. Pleural effusion, thoracentesis, may be used for large effusions causing respiratory distress. Empyema, drainage of infected fluid in the pleural space. Note: antibiotics and drainage are required. Long-term considerations, the big picture. 1. Monitoring for complications. Follow up to assess for improvement in symptoms and to identify any complications of the underlying cause. 2. Management of underlying conditions. Long-term treatment of the underlying conditions is necessary for many cases. 3. Patient education. Educate the patient on the underlying cause and any prevention strategies. 4. Note: patient education on medication and lifestyle modifications is key. Key takeaways for exam success and future practice. 1. Pleuritis is the inflammation of the pleura. 2. Understand the pathophysiology of pleuritis, including the role of inflammatory processes. 3. Recognize the typical clinical presentation of sharp, stabbing, and lateral chest pain that is worsened by breathing. 4. Know the common causes of pleuritis, infections, autoimmune disease, trauma, and malignancy. 5. Understand the diagnostic approach including imaging, CXR and CT, and pleural fluid analysis. 6. Be able to describe the management strategies including analgesics and treatment of the underlying cause. 7. Always remember to address the underlying etiology